to subside. After surgery, medication is administered to control pain. There are multiple options available to control pain. The surgeon will tailor the pain management plan to each dog's needs. While in the hospital, injections of morphine or another narcotic may be given to reduce any discomfort the pet feels. Another option is a fentanyl patch placed on the pet's skin. This will continuously deliver a narcotic through the skin during the first 4 days after surgery. In order to control your pet's pain at home, an oral narcotic may also be prescribed. The most common oral narcotic used in our practice is tramadol. This medication is tolerated well by most patients, but may cause an upset stomach, agitation, or constipation. A medication such as gabapentin may be prescribed to help block the amplification of pain within the spinal cord. A non-steroidal such as Rimadyl, Daramax, Previcox, or Metacam may be prescribed to reduce the inflammation in the operated elbow. Potential side effects of these drugs include a loss of appetite, vomiting, diarrhea, and dark-colored stools. If any of these side effects are noted, discontinue the medication and contact one of our doctors at Michigan veterinary specialists. Rehabilitation therapy is also very important after the surgery. For the first 2 days after the surgery, a cold compress, such as a bag of frozen peas or a chilled gel pack, applied to the surgical site will help reduce bruising and swelling. A thin towel should always be placed between the elbow and the cold compress to make your pet more comfortable. Starting on the 3rd day after surgery, a warm compress should be applied to the elbow prior to doing range of motion exercises on the limb. A warm compress can be a gel pack, a wet hand towel in a plastic bag, or microwaved raw rice in a cloth bag. Make sure the warm compress does not burn the skin by placing a thin towel between the skin and compress. Range of motion exercises are performed to regain normal range of motion of the elbow. Extend the elbow and hold it in this position for 5 seconds. Then flex the elbow and hold it in this position for another 5 seconds. 20 repetitions should be done 3 times a day. Checking the surgical incisions daily for signs of infection is important. Typically, no external sutures are used. The pet should not lick the incision because this will delay healing and may cause infection. If the dog licks the incision, a solution of 2 parts bitter apple and 1 part liquid heat can be applied around the incision. If this doesn't work, an Elizabethan collar should be used. Exercise should be restricted during the first 3 months after surgery. During the first 6 weeks after surgery, the patient is allowed outside on a leash for elimination purposes only. Running, jumping, and climbing stairs is not permitted. If unavoidable, the dog may climb stairs with the assistance of a sling. If a home has slippery floors such as tile, hardwood, or linoleum, then throw rugs or strips of outdoor carpeting should be used to cover these surfaces to prevent the pet from falling. During the 7th week after surgery, exercise should be limited to leash walks. A 10 to 15-minute walk is allowed 3 times daily and can be gradually increased to strengthen the limb. Arthroscopic surgery allows for early use of the limb after surgery. Nearly all patients will walk on the limb after surgery. By 2 weeks after surgery, most dogs will bear a moderate amount of weight on the limb, and by 2 months after surgery, most dogs will have mild lameness. By 4 months after surgery, the healing of the elbow will have plateaued. If your dog shows signs of stiffness in the limb at this time, long-term medications will be needed to help relieve signs of arthritis. Your pet should return for an evaluation of the limb in 2 weeks. A final evaluation is made in 2 months after surgery. All patients that have elbow dysplasia will have some degree of arthritis. These dogs should be kept lean, as excessive weight can make an arthritic joint more painful. Most pet owners are guilty of overfeeding their furry companions. A consultation with your veterinarian is important to assess the body condition of your dog. Your pet should have an hourglass figure when viewed from the top, and the ribs should be covered by a light coat of flesh. A weight management program can be formulated by your pet's veterinarian. Prescription diet food along with the correct meal proportions will